Hello everyone, my name is Dewayne White and I am a senior IT student at the University of Southern Mississippi. Today I would like to discuss with you about e-health and ethics. E-health and ethics. First I would like to give a brief introduction of what e-health is. What is e-health? E-health is healthcare services provided electronically via the internet. E-health is an efficient and cost-effective method of offering healthcare services to patients who are either underserviced or patients who either normally would get excluded from receiving better healthcare services. Why should e-health be used more? That's a good question. Digital health or e-health has the ability to enhance the patient care industry. E-health is shown to offer useful data sources for managing healthcare services. The digital health industry is growing. It is growing and developing at a steady pace. By using electronic healthcare systems, the hospitals become able to deliver quick service to its users and patients. Next, I would like to discuss some of the concerns that come along with e-health and ethics. First, e-health presents a number of legal and ethical challenges. Deciding how and whether to use this data is an important point of concern. The concerns that are presented consist of ownership of patients' data, informed consent for the uses of patients' data, data security, and data privacy. The basic risk associated with electronic healthcare record systems is that the information of patients can be used for various unintended purposes, and that such kind of information use can cause serious harm to communities or individuals. In that case, if challenges are not addressed, there will be a reduction in the quality of healthcare services that are offered among hospitals and clinics. Next, I would like to discuss the digital divide. The digital divide is exacerbated by electronic health record systems between patients without internet access and patients with internet access, thereby causing serious disparities of health among patients. Patients who lack access to internet services are more likely to have lower health literacy. They're more likely to have lower educational levels and lower socioeconomic status, all of which produce poorer outcomes of health among patients. Data inaccuracies and data integrity. As we all know, integrity develops an assurance that information is appropriate and it has not undergone any permanent changes. Numerous concerns have been raised about the reliability and accuracy of information infiltrated into the electronic healthcare system. Inappropriate treatment and condition of a patient generally occurs due to inappropriate utilization of different tools such as copy and paste. Such practice is inappropriate because it raises a concern for patients and places the entire responsibility on the shoulders of healthcare practitioners and clinicians. Destruction or loss of information takes place during the transfer of data. Therefore, it raises a serious concern about the database accuracy because most of the patient's decisions are taken on the basis of information available in those databases. Another major issue in the e-healthcare system is identity theft. This places inappropriate data into the victim's record. I would like to briefly discuss the security breaches within e-health and ethics. Security breaches to e-health can also take place when information about the patient's health is shared with others without getting the appropriate permission from the concerned persons. No system is 100%, but just like any other system, it's very important to use encrypted passwords to reduce the chance of a security breach. Lastly, I would like to go over some solutions in e-health and ethics. Various measures of security, such as intrusion detection, software, antivirus software, and firewalls should be taken into consideration to secure the data integrity of e-healthcare systems. For instance, hospital staff as well as patients should not share their login credentials with any unknown persons, and they should log off their systems when leaving the system. At hospitals, security officers should be hired to work in collaboration with members of IT-based health experts. And frequent audits must be carried out to assure compliance with the policy of hospital. The security rule developed by HIPAA requires hospitals to perform audit trials, demanding that they should have information about the activities carried out on the computer network and have the important software and hardware to examine and record the system activity containing information about the health of patients. This concludes my presentation. Thank you for listening. Goodbye.